My name is R-Eastell and I'm the Professor of Bone Metabolism at the University of Sheffield. I've been working with the International Osteoporosis Foundation and the European Calcified Tissue Society to work out how best to encourage adherence to oral bisphosphonate therapy for osteoporosis. We've been working as part of the Adherence working group, which is led by Dr. Diaz Perez from Barcelona and myself. We've just published our results in Osteoporosis International. What we concluded was that the best way to ensure adherence with therapy was to monitor it with bone turnover markers. What we suggested was that we measure bone turnover marker, such as P1NP, a bone formation marker, or CTX, a bone resorption marker, or both. And we do these measurements before starting treatment and again after having given the treatment for 3 months. We would expect both markers to go down by more than the least significant change. And what we concluded was that if they do exceed the least significant change, which is what happens in about 90% of patients who are taking oral bisphosphonates correctly, then we would call them a responder. And if they didn't exceed this amount, then we would call them a non-responder and suspect they were not being adherent. In that case, we would ask them carefully about how they were taking the medication and encourage them to be adherent. We defined the response by being a reduction of more than 38% for the P1NP and more than 56% for the CTX. We feel that by taking this approach, we'll be able to identify people who are not adhering well to the treatment and ensure that they get the full response by adhering. Thank you.